Good day, ma'am. I'm Ria Eliza B. Cordita, Biz in 1 Batch 2. I will be demonstrating the head-to-toe assessment. So I already arranged the equipment here on the side because it facilitates organized assessment. Next is I'm going to wash my hands to prevent the transmission of microorganisms. Good day, ma'am. I'm Ria Eliza B. Cordita, your student nurse for today. May I know your name and date of birth, please?
Nicole, December 22.
Okay, I will be assessing you from head to toe. Is that okay with you? Okay, this step is to assess the right patient and gain participation. And first, I'm going to inspect and palpate your head. So, head size is asymmetry, and your hair color is black and well distributed, and there is no animation. So next is the face. The patient face is symmetrical, as well as facial features, right and left side are the same. So ma'am, can you smile for me? Then frown. So I can say that her face is symmetrical. Then the eyes. The patient's eyes are symmetrical, and the eyelids is covering the sclera, which is normal. Okay, can you look at me straight to my eyes? So I'm gonna shine a light on your eye. The cornea is transparent, shiny and smooth. Details of the iris are visible. Pupils are equal, round, and reactive to light and accumulation. So next is inspect the ear. Okay, there is no foreign body present, which is normal. So next is the nose. Patient nose is symmetric. So ma'am, I'm going to calculate your nose. It will know if there is no any tenderness. Okay. Is there any pain? Okay, not tender and no lesion. Then you are going to upload one side of your nose, just like this. Inhale. Exhale. And the other side. Inhale, exhale. Okay, did you have hard time in breathing? Air move freely as a client breath, even the one side of the nostrils is open. Next is inspect the lips and oral cavity. So the lips of my patient is slightly, so there is no animation. Can you please open your mouth? The gum of my patient is normally pink. The teeth is white. Okay, can you stick your tongue up? Okay, the tongue of my patient is smooth with no palpable nodules. Then the neck, I'm going to palpate the lymph nodes. So, lymph nodes is present. There is no swelling and tenderness under the jaw. Then you're going to palpate your thyroid gland for a while. Okay. Is there any pain? The next is the thorax and lungs. So I'm going to auscultate the lungs. So the sounds of patient's lungs is bronchovisceral, which is normal. So assuming that the client already exposed her chest, So I'm going to take the lungs expansion. So the lungs expand symmetrical. Then I'm going to palpate your breast. Is there any pain? How about this side? There is any pain? Then I'm going to pinch the nipple to check if there is any discharge. Then auscultate for the heartbeat. Make sure that diaphragm is warm before placing it to the apice of the patient, so cold for 1 minute. So the cardiac rate of the patient per minute is 100 beats. So next is assess the abdomen. I'm going to auscultate the abdomen starting to the right lower quadrant. Then continue clockwise. Next is assess the genital area. Next is assess the lower and upper extremities. So I'm going to check your temperature. So the temperature is 1. Then pulse. And there is no pitting edema. Next is the lower extremities. So the temperature is same as the upper extremities. And there is no pitting edema. Next is assess the neurological status starting to the eye opening response. So ma'am, can you open your eyes? Okay. So the patient spontaneously opened her eyes, so it's scored as 4. So verbal response. So I'm talking to my patients. She is very well oriented, and so it's scored as 5. So next is for the motor response. So ma'am, I will just hold your wrist and you will raise your hand. Okay? I can feel that she is having her full force to raise her hands, so it's scored as 6. So a score is 5/5, then I already placed back the client into her comfortable position. And then wash hands again to reduce the transmission of microorganisms. Lastly, document the findings recorded. Findings serve as the basis and subject for validation of the doctor.